You've had an injury recently and you're wondering, is it better to rest? Should I move it or should I just take a break? I'm answering that in this video. My name is Dr. Garcia. I'm a leading expert in physical therapy and rehabilitation, and I'm here to help you, help guide you towards feeling better after your recent injury. Now, there's two sides to this. You can rest it or you can push through. Now, there's good and bad to both sides, and I'm here to explain that. So let's talk about the rest issue. Let's see what happens after an injury. Now, anytime that you have any form of an injury, a back strain, a muscle ache in your neck, a twisted ankle, a sprained knee. Now, what typically happens is you twist your knee and your body's going to send inflammation to that localized area. That's going to cause a little bit of inflammation, and all that tissue goes in to try and repair and not have so much inflammation. It'll try and clear it out. But initially, you have this huge rush of blood flow to that area, and that's about 3 days of that. So the first 3 days after injury, you think, gosh, maybe I should get some crutches. You're limping, you don't feel so good, and then you start feeling better. Typically after a 2-week mark, your body kind of starts to process that. There's less swelling, maybe it's less purple or less green swelling, and that tells you that your body's healing. Now let's talk about if you were to rest that same injury. If you were to rest it completely, here's what happens. All that inflammation goes in, and normally when you walk or move, your body pumps that inflammation out of there, so it filters it all out. Now if you were to rest it, maybe raise your leg up in the air or not use your back or whatever it is that you recently strained and you did a complete rest, all that inflammation would stay there. It wouldn't go anywhere. So you would create scar tissue, and it creates almost like a callus, and it becomes immobile. So you lose the flexibility, it becomes stiff, and it becomes worse and even doubles your time to recover from. So now let's take the opposite. What if you said, well, that same ankle, I don't care, I'm gonna go run on it. I don't care, I'm gonna go play pickleball on it. And now you go and you put pressure on that, your body's not gonna like that, and it's gonna react with more swelling to slow you down. So you have one side of, is it better to rest? Or the other one is, can I continue pushing through it? The actual answer is right in the middle is the best sweet spot. So in the first 3 days, you want to allow your body to heal. So you'll do some gentle range of motion to get some of that inflammation out. After that 3-day mark is really where you start to want to explore, maybe walking on it. You're not doing any twisting or hard impact activities like running. You want to get to that 2-week mark, which allows you to recover properly. And after that 2-week mark, you can put some pounding on it. You can start maybe testing a little bit of twisting, but most people don't know. Absolute rest is the worst possible idea to do. That was an old thing that was done before in the 70s, 80s, and even maybe the 90s. And research has shown that gentle movement, if there's no broken bone or anything torn completely, you're more than okay to slowly start weaning from just the less mobile activities. But also you don't want to go in and ignore it and just start playing tennis or softball right away. There's a happy medium. And it's all about the timelines. So in those first 3 days, respect it. Then you can slowly do it. Once you hit that 2-week mark, you can start to be a little bit more aggressive. If your pain is lasting more than 2 weeks, you should probably see someone about that. Maybe a physical therapist or someone that you trust. If it's past that 6-week mark, you've waited too long. It is way too long to be seeing somebody because you have a lot of scar tissue formation. It's going to take you a lot to be able to get that out of there and gain the mobility back. So is it better to rest after an injury? No. Is it better to push through? No. What you want to do is respect it, listen to your body, and give yourself a chance to heal properly. If you continue to push that, or you've gone too slow, you're going to put yourself in a position where your recovery timeline, you can potentially double, if not make permanent changes. So the best thing you can do is seek out a healthcare professional who understands this, who understands your needs, your timelines. Maybe you want to go play in a tournament soon, or you have an important vacation that you want to be able to go to. In other case, you want to go to somebody who understands these timelines, and that's not going to tell you to just do complete rest or pass through it. There's a happy medium, and it takes a very unique healthcare provider to be able to do that. So if you've felt stuck, you haven't been able to solve your pain, you're just having this injury, and you're wondering, should I rest it? Reach out to my team and I at Sports Performance Physical Therapy. We'd love to be able to guide you in the right direction, answer any questions you may have, understand exactly what happened, understand your timelines, if you've had any x-rays, who you've seen, and then help determine, is this the right thing to do right now to put you in that that right direction so you don't actually slow down too much, you don't delay your recovery, you don't create any permanent damage. So you can contact us at the contact information below, and we'll be excited to point you in that right direction, and we look forward to helping you recover safely. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on improving your lifelong health without aches and pains. Thanks, and I'll see you soon.